I was fairly young. Wojciech is the spoken name, and it at one point in my life got shortened to Tech, and hence that became Dr. Tech. So thank you again for joining. A quick background. I went to college at Yale, then subsequently moved north and attended Harvard, MIT Medical School, at which point I stayed in the Harvard system and did my residency in combined integrated plastic surgery, where I was the chief resident at Mass General Hospital, Brigham and Women's Hospital, Beth Israel Deaconess, Boston Children's, and Shriners Burn Hospital. Spent 6 years training with some of the best surgeons in the world in plastic surgery, and then went west and performed and did my fellowship at the Bunke Clinic in San Francisco. Subsequently to this, I spent another 9 years as an associate professor at the University of Kansas, performing surgery and training plastic surgery residents, and have then moved to Denver, where I've been for approximately 5 years. And joined a great group of partners where we began and started La Vie Plastic Surgery. I'm one of the founding partners in this enterprise, which has been very, very exciting. Also a Castle Connolly top doctor when I was in Kansas from 2018 to 2021, when at which point I moved to Denver, and then in 2024 again, and then 2025 and 26 became a Castle Connolly top doctor in Denver, and as well as the 5280 magazine. Thank you. I'm also a board certified plastic surgeon and a fellow of the American College of Surgeons. As many people know, weight and obesity has been a tremendous problem and really a disease in the United States and the world, in the modern developing world or in developed world. This is often associated with significant comorbidities such as diabetes, hypertension, other related maladies, and so weight loss has made a tremendous impact in terms of bettering people's lives and health. Different ways of losing weight exist. Many people know about bariatric surgery, where modifications in the digestive system are made to help limit the amount of food and calorie intake and amount of food ingested, as well as decreasing the absorption of the calories to help patients lose weight. Additionally, new medications such as GLP-1 agonists, such as Ozempic, exist, which use pharmacotherapy in essence, doing the same thing, providing early satiety, decreasing absorption, which can help with weight loss. The major components, there's really three major components of gastric bypass surgery. One is restrictive, such as a gastric band or laparoscopic sleeve gastrectomy, which decreases the effective size of the stomach, and so then the patient feels full and decreases calorie intake. The malabsorptive diverts nutrients to interrupt the normal digestive process, and decreasing calorie absorption. And then there's also combination therapies as well, which both reduce the stomach size and increase early satiety, as well as decreasing absorption of nutrients. And so adequate nutritional and calorie intake is really essential for post-operative healing. And so this is one of those aspects of post-weight loss surgery and bariatric surgery that we as reconstructive and cosmetic surgeons that do a lot of these operations really focus on, because we want to optimize your healing potential and decrease complications, which can stem from malnutrition, folate, calcium deficiency, iron deficiency, vitamin B deficiency, which are all essential for the healing process, as well as zinc and selenium, which are critical for good wound healing. And so daily supplementation before and after surgery is essential. And it's one of the things that we here at Levy, we focus on as well.
My initial problem was I had just lost over 100 pounds.
Excuse that mild interruption. Yeah. So you have done the work and you've lost the weight. So what's the next step? Next, we would recommend a consultation with here at Levy Plastic Surgery. This is where you will meet me, your plastic surgeon, also our patient care coordinators who will really act as your ambassadors and your guides throughout the process. We discuss the areas of concern with massive and large weight loss operations. There often are multiple anatomic areas that could benefit from skin reduction, and patients often have multiple areas that they would like to have addressed. And so we prioritize and make a plan so that we both increase the safety as well as really discuss the expectations from each of the operations. We talk about zones of adherence. This is where the attachments between the skin and the underlying muscle prevent skin from stretching. And usually these are in the midline, on the anterior and posterior torso, as well as around the pelvis. And the loose skin, as people lose weight, the loose skin basically descends around these zones. We talk about scars. We examine and discuss possible correction of any hernias that might have developed. We also talk about rectus diastasis, and that's seen on kind of the lower schematic. And rectus diastasis is essentially a separation between the abdominal muscles. It's kind of what often are known as like the six-pack muscles. And whether it's through pregnancy or obesity, these muscles can separate. This very often significantly impacts your core strength. And so during abdominal operations to reduce skin, when we notice rectus diastasis, we correct that, and that significantly can impact core strength. It can actually have positive effects on urinary symptoms as well. So it's very important to address this when having skin reduction. For completeness. We discuss the extent of the excess tissues that can be removed, and also what kind of the realistic expectations. And then we discuss any other coexisting deformities, such as the mons pubis, which is not often talked about, but certainly becomes an issue with weight loss as well. We take photographs, and then we come up with a customized plan to address and prioritize the issues that you would like to have us correct. So the other important factors include general health, medical clearance, smoking, and nicotine cessation. This is critical as nicotine vasoconstricts vessels, which are essential, especially in the skin, for healing. And so patients that use nicotine products, smoke, vape, even nicotine chewing gum or patches can severely increase the complication rates. And so we really need essentially 4 to 6 weeks prior to surgery, elective surgery, and about 6 weeks after surgery to be nicotine-free in order to decrease complication rates. And then any medications, and we talk about your herbal supplements that you may be taking, as some of these increase propensity for bleeding, and also how much protein, what is your normal kind of nutritional level. Most patients require 1 to 2 grams of protein per kilogram daily. However, around surgery and after surgery, that can increase by 1.5 to 2 times for approximately 2 to 4 weeks before and 4 weeks after. And And this gives you, the protein is really the building block that your body needs in order to heal your incisions and heal your scar. And so understanding the journey, really, we focus on social and community support. This is critical, especially around the pre- and post-operative period, as there's going to be a lot of changes both in your early activity. We encourage patients to continue with a healthy lifestyle. These really are incorporated into and should be incorporated into the remainder of your life to prevent gaining additional weight and potentially jeopardizing your results. There will be identity shifts, long-term maintenance, kind of what's necessary and beneficial in order to really keep looking and feeling your best. You'll develop new routine habits. Chances are you may benefit from a new wardrobe, as the clothing you have before skin reduction surgery will no longer fit you. And then we talk about recovery expectations. What's a normal result? What can we expect? Set a realistic expectations for the surgical process and after surgery. So when do you get surgery? So we recommend that surgery be performed when you're close to or at your goal weight. There's some caveats to this, and we'll talk and show you some patient examples for this. But in general, we want your weight to be stable for at least 3 to 6 months, and this is usually 12 to 18 months after bariatric surgery. And as your weight approaches your goal BMI, really the aesthetic results are optimized, and this really improves your outcome, your aesthetic outcome.
My initial problem was I had just...
Who's that? Yeah, I just keep pressing that button. And let's talk about some terminology. So paniculectomy or aponeurectomy is primarily a reconstructive procedure where we remove the skin and fat from the anterior abdomen. This is people that have lost large amounts of weight. The abdominal skin hangs below some of these points of adhesion, and it essentially looks like an apron. And so we can remove that in order to improve your physical activity, as well as being able to fit into better clothing and improve your ability to exercise in order to lose more weight. This also has a pretty important impact in terms of improving hygiene. An abdominoplasty or a tummy tuck is an aesthetic procedure that removes excess skin and fat and also tightens the abdominal wall and repositions the belly button. This is where we often perform the rectus muscle or six-pack plications in order to improve your core strength and decrease the basically the width of your waist as well. At fleur-de-lis, abdominoplasty has a vertical component that helps decrease the circumferential extent of your excess skin. Lower body lift is essentially a tummy tuck or an abdominoplasty that also goes around the back and removes back skin to help elevate and enhance the buttocks, as well as remove excess posterior flank skin, and is combined with a tummy tuck on the anterior portion of your torso. Mastopexy or augmentation mastopexy are breast lift procedures with or without adding volume and size. Patients that lose a lot of weight also lose, especially women, also lose upper pole fullness in their breasts, and so are usually really good candidates for a breast lift. Brachioplasty is an arm lift or upper arm contouring. A monsplasty is a thinning and resuspension of the mons pubis area. Men with weight loss develop what appears to be gynecomastia. It's technically not just breast tissue, but often skin and fat, and has the appearance of gynecomastia that they often like to have addressed. Thighplasty is a thigh lift, and then we often perform buttock contouring and a buttock lift while doing the belt lipectomy to enhance the appearance. And an upper body lift addresses the chest, bra rolls, and posterior trunk. So here are a couple examples. Upper left is an aponectomy or a piniculectomy, where we essentially come across and divide the pannus and resuture the skin. This does not address the rectus muscle tightening, does not reposition the belly button. A circumferential abdominoplasty removes the anterior abdominal walls or anterior abdominal skin excess, performs the repair of the muscles, but also carries this in the posterior direction, removing the excess flank skin, elevating the skin over the buttocks, and often combined with the buttock augmentation. Extended abdominoplasty extends the incision to the lateral portions of the flanks, but does not go all the way around the back. And a fleur-de-lis abdominoplasty combines a vertical component to decrease the circumferential excess of the skin above the belly button. And here, this schematizes kind of the issues with the excess skin. So when patients lose large amounts of weight, the excess skin isn't just on the anterior or on the posterior of the trunk. It goes all the way around. And so in order to improve the shape and decrease, we really have to address both the front as well as the back skin in order to kind of really reveal the underlying natural shape that you have after your weight loss. Brachioplasty is skin and fat removal of the upper arms. This is often a troubled area, especially for patients that want to wear tank tops or short-sleeved shirts. As there's excess skin and fat, this is often combined with a liposuction of this area in order to decrease tension on the closure. And really, as plastic surgeons, our goal is to try and hide the incision so that it's not visible when someone is looking at you from the front as well as from the back. And so usually these incisions are very well hidden, kind of on the inside posterior portion of your arm, and very often extends onto the chest to remove excess chest skin. A thighplasty reduces the circumferential as well as the longitudinal length of the skin. This can be performed as purely like a T-shaped incision, or combined as a mini thigh lift in the upper portion of the thigh without removing the circumferential skin excess. In patients that have lost a lot of weight, usually both components are utilized in order to give you the best contour and best appearance. Here's a gynecomastia with weight loss. You can see there's different grading systems, but essentially as men lose weight, they also lose that from the upper chest area, and which results in skin excess and drooping of the male breast, and this is also corrected. This is an upper body lift, and it shows, schematizes the removal of the excess skin where the incision is kind of across the back and where the normal bra roll would be. And of course, you don't just lose weight over your body and extremities. The face also ages. And so patients that have lost large amounts of weight experience premature facial aging. Often this is addressed almost as a kind of a last step in facial rejuvenation. It's often combined, we often combine it with a deep plane facelift as well as fat grafting in order to really restore the normal components and the normal appearance of a youthful face. Often combined also with a neck lift, neck muscle plication to both remove the excess skin, but also give you a nice jawline and contour of kind of a youthful neck. And so some safety considerations here at La Vie, we are a fully accredited surgery center, a Quad A center. This is probably the gold standard for non-hospital-based surgery offices as far as accreditation, and are focused on safety and strict adherence on both the recommendations and adherence to the safety rules as stipulated by Quad A. We focus on prevention of hypothermia. One of the complications with having prolonged weight loss surgery can be the development of deep vein thrombosis, which can lead to a pulmonary emboli. We certainly focus on both pharmacologic as well as mechanical prevention of clots, both during and after surgery. And then we focus on the length of surgery. There are safety guidelines in terms of how long a surgery can be safely performed. Going beyond those guidelines, the risks of complications increase. And so we have a strict adherence to this, which also limits how much surgery can be done at one time. And so that's why we really focus on kind of your goals, your priorities, your desires, to make sure that we meet them within real safety limits. So why get body contouring surgery? It's because you deserve to look good, you deserve to feel healthy, and you deserve to feel good about the weight loss, your weight loss achievement. This is really a tremendous milestone, and it's really the kind of the pinnacle of your journey, the end of your journey, because you've put in a ton of work, and yet many patients are not quite happy because they don't look and feel really the way that they would think that they would with all that weight loss because of the excess skin and the trouble areas. And so I think everybody that's gone through deserves to feel and look their best. Additional factors that may impact your desire and your benefits of skin reduction and weight loss after weight loss. It decreases back stress. Patients experience hygiene issues, especially where skin touches skin, often especially during hot months or hot, warm climates. Rashes develop. There's emotional distress. Difficulty fitting clothing, difficulty with exercise, the loss of skin elasticity. And so the skin reduction surgery can result in improved self-esteem and confidence, improve your hygiene, improve your activity, clothes fit better. Very often this leads to actually additional weight loss. Patients can exercise more freely, and really seeing the benefits really inspires people to continue on their journey and really make a true lifestyle change. And can result in improved health, improved glucose tolerance, and decreased blood pressure. During skin reduction surgery, we often will encounter ventral hernias or the rectus diastasis, which is the six-pack muscles that are separated, which we correct. There's relief of chronic rashes in the skin-on-skin areas, improvement in insulin resistance in some cases, improved ambulation and exercise. When we do mastopexy or breast lift surgery, there's also improvement in upper back pain and posture and neck pain. There's relief of broad strap and shoulder grooves, allows for better physical activity, and it also additionally prevents the rashes that can form underneath the breasts. So some of the additional safe body contouring recommendations. So we try and limit surgery to 8 hours at a time. We often stage procedures to achieve the optimal outcome. perform usually the abdomen or body lift, then the extremities and chest, thighs, perform any revisions, and usually most people adjust the face and neck kind of as a last step in their journey. And we also, anytime we do secondary, tertiary surgeries, there's always an ability to kind of revise anything that may benefit from small revisions. And so your journey with LaVie, we feel very passionately about lymphatic and compression support. Celine, our surgical lymphatic specialist, is amazing and meets with you before surgery as well as after surgery to perform lymphatic massage and give you instructions in order to recover as fast as you can and decrease swelling and edema. And she's amazing. We also provide IV therapy and peptides both pre and after surgery in order to optimize your healing potential. You can expect to take time off of work for about 2 weeks. This is dependent on your physical activity requirements at your work. So a manual laborer that may require, or manual laborer may require additional time off, but most people can return to work in about 2 weeks. Again, depending on the type of surgery that we perform. Strenuous activity and exercise, we usually say about 6 weeks. Swelling can persist for about 3 months. Scar maturation, so you'll know kind of what your final scars will look like at about a year or so. And then the other thing that we really encourage you to have is support at home. This is a committing process. You know, there is definitely a recovery period. And so having a good home support is essential. Very often with skin reduction surgery, you will have drains. These stay in for usually 1 to 2 weeks. On the right, here's a little photo picture of what these look like. They're very easy to manage and they help prevent fluid accumulation. And they're just removed in the office. Doesn't require any additional sedation or any local pain control. We just pull the drains out. Some adjunct procedures, very often we will combine our surgery with liposuction. Here at LaVie, we use both a power-assisted liposuction as well as a vaser, which uses ultrasound technology to help essentially emulsify and break up the fat. This also does help with some skin tightening during the procedure and helps with removal of skin by removing some of the excess fat. Additional modalities such as soft wave, which also uses ultrasound as a non-surgical procedure to help essentially heat the kind of deeper part of the skin, and that then during the healing process causes skin tightening, and radiofrequency microneedling, which can also help with some of the skin tightening. And facial fat transfer can be performed to help address some of the volume loss that patients experience with weight loss. Here's some procedures that we have done at LaVie that can show you some of the results that can be expected. This is a woman who had an extended abdominoplasty with tightening of her abdominal muscles as well as a breast lift. This was performed during one operation. She wasn't quite at her goal weight, but wished to have improvement in exercise. And since the operation, she has now healed and has continued on her journey and has continued to lose weight. This is a woman who lost less weight. She also had a couple pregnancies and just had stubborn abdominal fat areas. Underwent a abdominoplasty with the plication of the muscles as well as a silicone implant augmentation. You can really see the change in her shape, and she's super thrilled with her results. Another woman who was at her goal weight, she was happy with the weight, but really did not like the excess pannus or the apron she had. She underwent an extended abdominoplasty. Here's an kind of a half lateral view of the improvement in her abdominal shape. And you can imagine what this does to even obtaining both clothing, new clothing, as far as fitting into clothing, as well as exercise, the ability to exercise more freely and just improve her confidence. Here's another woman who underwent an abdominoplasty with rectus plication. This is the lateral view of the same patient. This is a woman that experienced over 100-pound weight loss. She underwent a fleur-de-lis abdominoplasty on the left. In the preoperative photo, you can see you can't even see where her belly button is because of the skin excess. And this vertical scar is part of the fleur-de-lis component. She had a really nice result. You can see the improvement in the back skin as well as the shape of her buttocks from doing an auto-augmentation during this belt lipectomy component. This is a gentleman who underwent a belt lipectomy as well as vasoliposuction of his chest. Significant improvement in terms of his waist. And here's the belt lipectomy and posterior component, improved shape, and he's thrilled with his results. He's in the early postoperative period. This is a woman who, her primary concern was her arms, as well as her deflated breasts. And so here she underwent at her first stage, she underwent a brachioplasty as well as a silicone implant breast augmentation with an internal mesh bra support. We often use this mesh, which is dissolving but sticks around for anywhere from 3 months to 2.5 years or 3 years, depending on the mesh that you use. And this really helps to support the implant and the breast tissue to prevent bottoming out, especially with patients that have lost a lot of weight, as their elasticity and their skin quality is often not adequate to support implant placement. These are her arms. You can see the reduction of the posterior and the lower arm skin. Again, this is early postoperative period, but you can see the improvement in the contour and the well-hidden scars. This is another patient who also underwent and experienced a large weight loss. She really did not like the excess skin of her arms, underwent a brachioplasty. And this is her postoperative appearance. This is a gentleman who was at his goal weight, even though he was still a little heavy. He did not like the abdominal skin. He underwent a belt lipectomy. This is a pre and postoperative view of the decrease in terms of the fat and skin over his abdomen with the construction of this new belly button site. And this patient actually also went on, after surgery and recovery, he has now lost another 30 pounds and is thrilled with his increased stamina and activity and ability to exercise. This is a woman that underwent paniculectomy. She understood that she was definitely not at her goal weight, but the large skin and fat apron really hindered her ability to exercise. So she underwent a paniculectomy or apronectomy. We did not resite her belly button just to preserve the blood supply. And as she loses more weight, we will do more definitive abdominoplasty where we will resite the umbilicus or the belly button at her more natural position and perform additional skin removal operations. This is just a lateral view. You can see the improvement with removal of this large apron. So thank you for joining me. If you have any questions, please give us a call or send us an email. We're happy to see you and help you through on your journey. We're excited to meet all of you and hope you will come and consult with me.
My initial problem was I had just lost over 100 pounds and I was dealing with excess skin that I wanted removed. It affected my fitness routine. It was just kind of in the way. I did a lot of research and I kind of called around and they made me feel at home. They made me feel like it was going to be okay. I was very scared of getting the procedure. Yeah, they're the only ones that kind of made me feel at ease. My main concern was that perhaps I wasn't at the correct BMI. Dr. Tech assured me that my BMI was fine, that it wasn't going to be a problem. I'm so glad that I did it. Like, I wish I would have done it sooner, to be honest. I look better in clothes. I'm pretty early in my recovery, so I haven't gone back to the gym, but I'm excited to get back into my fitness routine and stuff. I'm excited to start running. I used to run in my 20s and I wasn't able to after I gained and lost the weight because it was kind of throwing me off balance, the extra skin and stuff. Definitely, I would definitely recommend Dr. Tech. He just makes you feel at ease, like everything's gonna be okay. He is on call. I could text him any time of the day or the weekend and he gets back to me within minutes. And he addresses all my concerns and he makes me feel at ease. I would say thank you. This was my first surgery and I was really nervous about it, and it makes me want to do more. Like I'm like addicted now.